Topmedtalk.
Hello, my name's Nick Majerison and welcome to Topmedtalk News. New figures this week from NHS Digital say UK hospital admissions, where obesity is a factor, have more than doubled in England over the last 4 years. Previously, 292,000 appointments where obesity was either a primary or secondary diagnosis were admitted between 2012 and 2013. Now, between 2016 and 2017, there were almost 617,000 such appointments recorded. Primary diagnoses involve weight loss treatment, while secondary diagnoses include hip problems and heart attacks. A secondary diagnosis of obesity means it would not be the reason for the admission, but instead a significant factor that may contribute to the health issue and affect the type of treatment a patient receives. NHS Digital said it was possible that some of the increase in obesity-related admissions may be down to better recording of obesity by doctors on patient notes. The BBC reports Public Health England as saying this increase shows obesity is a significant challenge. For more on this story from a perioperative perspective, check out the following 2 podcasts. Firstly, should you have to lose weight before you get a new knee? And secondly, rehabilitation. Exercise is real medicine. You can find these by searching via your podcaster or on topmedtalk.com. Also this week, Fox News reports more than 220 cases of a breed of nightmare bacteria with new or rare antibiotic-resistant genes has been found in 27 states. The US Centers for Disease Control and Prevention has warned of the antibiotic-resistant bacteria for years, but these nightmare bacteria are virtually untreatable and capable of spreading genes that make them impervious to most antibiotics. This according to a new report out on Tuesday. The nightmare bacteria are particularly deadly in the elderly and people with chronic illnesses, as up to 50% of the resulting infections are fatal. About 2 million Americans get sick from antibiotic-resistant bacteria each year, and 23,000 die, the CDC has reported. Dr. Amesh Adalja, a senior scholar at the Johns Hopkins Center for Health Security, told Scientific American that the unusual genes discussed in the CDC report were truly the worst of the worst. And finally, The Guardian reports Prince Philip as being in good spirits after a hip replacement operation. The 96-year-old underwent a planned procedure on Wednesday after suffering with a hip problem for about a month. The Queen, who's at Windsor Castle for the traditional Easter court, is being kept fully informed about the condition of the Duke, who was admitted to the private King Edward VII Hospital in Marylebone, central London, on Tuesday. A statement from the Royal College of Anaesthetists reads thus: "While we do not know the type of hip operation proposed, we can be certain that the Duke of Edinburgh will be cared for and supported by a team of perioperative physicians before, during and after his surgery, comprising anaesthetists, surgeons and other specialist medical practitioners. The multidisciplinary team will focus not only on supporting him through the operation, but also, importantly, working to ensure a speedy recovery and the best possible long-term outcome. As with any patient, the anaesthetic team involved in His Royal Highness's care will have discussed the option for anaesthesia with him, taking into account his general health and his wishes before deciding on the technique to be used." That's a statement from the Royal College of Anaesthetists on the Duke of Edinburgh undergoing elective surgery. Buckingham Palace said in a short statement, His Royal Highness is likely to remain in hospital for several days. He is comfortable and in good spirits. Details about which of the Duke's hip joints was replaced have not yet been released by Buckingham Palace. Philip stepped down from his public duties last summer, but on occasion attends events with the Queen. Topmedtalk News is a trial programme here on Topmedtalk. If you'd like to submit a story to us or make comment, contact@topmedtalk.com is our email address. That's contact@topmedtalk.com.
Topmedtalk.